Hey y'all, welcome to Vetted and Vet Med, the podcast where two African American female veterinarians pull back the curtain on the life and the world of veterinary medicine. I'm Dr. Wilson.
And I'm Dr. Levy. Join us as we dive into real conversations about mental health, career transitions, work-life balance, and the unique experiences we face as Black women in veterinary medicine.
So go ahead, grab your stethoscope,
and get your favorite cup of coffee or wine, and let's get vetted in Vet Med. Hey guys, thanks for coming back to listen to the final part of the Diary of a Corporate Black Woman. We have thoroughly enjoyed sharing our stories and our perspectives of our experiences as Black females working in veterinary corporate medicine. So stick around for this last part. The series is finally ending, and stay tuned for our next episode where we'll have a guest speaker who's also a female Black veterinarian. But she's going to also be giving her experiences, sharing her perspectives, working in veterinary medicine, and also as a practice owner. So, y'all stick around for that. I know I have different ways of communication in regards to like communicating to these clients. When I go in there, I do spend a little bit more time with them. And that is why people do like me. Because I'm like, I am genuinely, trying to get to know you, trying to get to know your pet. I'm like, I don't stay in there forever, but there are some times where I might need to be rescued from some of these clients.
press that button. Press the button.
But I feel like I don't know. I mean, for a lot of times I would, I'm talking to them, but I am able to convince them to do what it is that like they trust me. So they're doing what I'm asking them to do. And even some people would call to specifically ask me to go over, even though I might not have been the one to do the blood work, but they would call to request to talk to me to have me go over the results again with them because I would be able to break it down for them to where they understood. And I think that's my main goal is them really understanding what the heck is going on with their pet. And I feel like even though the other doctors that I work with, they were direct, but I don't know. I feel like sometimes they were maybe kind of brief. And so like they went in, they said what they had to say, they did what they had to do, and they was up on out of there. And which for some people that works, but a lot of people that's coming in there, bringing their pets in there, they have no clue. They don't know what, yeah. So
You're gonna be like the other doctor. What, the McDonald's? What, the Sonic? What, the Arby's?
Oh Lord, but yeah, and when I had poured my heart out to my boss, like, when I said I was just kind of at my ends, she was saying that, oh, well, we actually have a new, like that time we finally got like the person that oversaw our area, all the vets in our area. So after spilling out my heart to her, that didn't really get me nowhere. She did share my concerns with this new person, and then I yet again had to do the same thing to this new position. Somebody I don't know, never met, and I didn't even know that we had one starting until I poured my heart out to her. Then she was like, "Oh, well, we have such and such starting." I'm like, "Oh, I didn't even know." So then when I met this person, then I had to give all my concerns once again to this new person. And He was really nice. And again, I felt like I was back in the same situation like what I was at the first corporate clinic, where now we have a new person that's coming in here to save the day. And I'm already out the door.
You tapped out. You tapped out. I get it.
So I talked to him about it, and I did actually see he followed up. I saw immediate changes like within that week, and the following week, but literally it did not last longer than 2 weeks. And so some of that included adjustments in the amount of pets that I was seeing and the way that things were scheduled for me, because I don't want to see a vomiting and diarrhea at 5 o'clock. I feel like there should be a cutoff time for some types of sick cases. And then I feel like even the rechecks, there should be more time allotted for that. They like to throw those in as double booked or triple booked. And depending on what it is, that's like a whole nother sick appointment.
Yeah, sometimes it didn't resolve. Sometimes things get worse. Sometimes they got a new issue.
Right, right. It didn't last long. It didn't last long. So from there, I just had to try to make my exit strategy. And trying to think of what the nail on the coffin was for me. I think it was that I think I may have like walked into the clinic one day and saw my schedule, because I was tired of skipping lunch,
Hmm. Hmm.
working through lunch. I was overworking through lunch. I was over staying late, and also I was experiencing what you had mentioned before about the car ride in, sitting in the parking lot. Definitely times where I would sit in the car and cry. I always had to pray before I walked in, just trying to set the vibes, the energy for the day. And every day, I always walked in. Good morning. I literally said good morning to everybody that I would see. And some of them people would not say good morning. I feel like I
Yeah.
was too much of a bright light up in that dark clinic, to where I feel like my presence walking in there was
It disturbed
like,
the demons.
yes, I feel like I was disturbing demons in that clinic. I really honestly do. And just me saying good morning and having like because even regardless of what I was going through, I still, would be positive externally. And I don't think they like that. So sometimes they wouldn't even say good morning back to me.
I
Um,
believe.
or wouldn't say hi, or even that one that she would come and just start talking to me, hadn't said good morning or nothing, but just start talking about a pet that, was seen, or a different case or something like that. And I would always be like, good morning, before, because I'm like, I don't know why that is
Yeah.
just like a stickler. That's just one pet
Um,
peeve for
it's an
me.
introduction to the day. Like, have
Today.
I seen you today? Just like, just like black folks, you come to somebody's house, you better speak.
Yes.
Same thing. That's the pet peeve. Like, don't walk in here and don't speak.
Yeah.
That's a common courtesy.
Yeah.
I afford you this courtesy, you should afford it back to me. The same thing about respect.
Mhm. Mhm.
And I can take it away too. So,
It was weird. And again, I don't know, like I said, I don't know. I try to stay out of the side conversations. I never talked about anybody there, because I honestly didn't know who I could trust. I just
hmm,
didn't trust nobody.
yeah.
So whatever ways that I felt about people, I never said anything to anybody,
And
because
I feel like you were worse off than me because you didn't have an outlet. You didn't have anybody to talk
mm-mm,
to. I had my practice manager. I had,
mm-hmm,
you know, my home girl who was a nurse, and we you have your allies and
Mhm. Mhm.
your safe space, and you didn't even have that.
I
So,
did not. I didn't. Because when I was at the other location, I did have the area chief of staff, and that was one person that I could vent to. And the vet there, I wish I could have taken him with me to the new location
mm-hmm.
because he he shared like we was here on how we felt about our experiences, and he had been there longer than me. So but he knew he was the only full-time vet there, so he just was sticking it out and dealing with it. But he, he
But
had
see, I
had
feel like
his, yeah.
that that's the thing. Like we oftentimes do that. I did that, just feeling obligated to the job because you're the only person. Like you
Hmm.
have to be the saving grace. And quite honestly, um, when I wish not necessarily had this attitude because I got to the point where like, okay, I might be the only person, but I let all this burn. That became the thing.
Hmm.
All this can burn. It can burn.
Hmm.
I will watch it from the outside because on the inside, I'm not going to sit here and suffer and drown with y'all. We used to
Hmm.
literally refer to those places as the Titanic. Like we are underwater. There's no saving us. The life jackets are gone. The lifeboats have left. Like we're gone. We're done.
Yes.
Everything's done. So I mean, and we were going through it at the same time apparently because I left in November.
Yeah, that was when I put my notice in, and I always try to put to, a fair, what I think is fair, notice if you can. And so I did.
Yes, guys, it's a very professional way to do things.
Yes, yes.
I
I
get it.
mean, I try to put together some type of exit strategy. That includes, trying to save some funds on the side, and also trying to have something secured afterwards.
Yeah,
But I knew that I did not want to go into another associate position, and so I just, decided I'm going to go back to relief, and then I'll figure things out from there. But I have not ever, like, as a real adult, I have not just walked out on the job. I did that years ago working at the
yeah,
mall. I said I'm not coming back. After a lunch break at that. I
yeah.
said, she said, not even, can we get you for one day? I said,
Hmm.
I'm not coming back. But as an adult, I have not walked out on the job, even though there have been so many times, and at that particular location, there have been times where I have literally walked in there and went, looked at that schedule, and even the technicians, they know, and shout out to the technicians that try to advocate for you.
Amen. Amen. There's
But
some real ones out there.
they don't always know how to hide the drama that's already going on before you get there. Because as soon as I walk in the door, and that's one thing, don't come to me with nothing. Let me put my stuff down. Let me, settle in before you come to me with foolishness. But they come because they trying to set you up for the day,
Mhm.
like make you aware. Like, I tried to help you, but they
Thank you
would
for
not
slowing down,
listen.
slowing down. Just then.
I've even had a tech call me before I came in, like, Dr. Levy, this is what's happening. And I don't even want that.
Yeah.
I appreciate it. Let me come in clueless.
Yeah.
Just let me come in clueless, because now I'm already in my car just
Hmm. Yeah.
upset.
Just mad. Not only am I already gonna sit here for about 30 minutes, I'm mad. I am mad about things that are going on inside this hospital I have not even walked into yet. Jesus. Ugh.
they tried, several of my technicians tried to advocate for me to, stick by because at one point there was even the notes under my name as to how many surgeries, how many sick pets. Like there was notes under my name. How long did that last? I don't know, because at some point it disappeared. And it was just by the end, it was a free for all. Like there was no acknowledgement of anything that had been previously discussed as far as like what I felt like I needed for myself to get through the day. It was all gone down the drain, and they was doing whatever they wanted to do with their schedule. And I knew I was leaving, so I said, whatever. I can do whatever y'all want to do. It almost felt targeted at that point, but I'm like, I'll be out of here.
I'm sure it was.
Mm-hmm. Mm-hmm.
Just seeing the other side of things and knowing how people can be, um, I'm sure it was.
Mm-hmm. Like I
I'm
felt
sure.
like they wanted me to leave before it was my time to leave. That's
Yeah,
what it was feeling like to me with that schedule, because it was just some foolishness on there, and it was like take whatever comes in, like,
yeah.
and it was added to the
Want to go,
schedule.
go. Yeah,
And that's what they were being told to do. They were being told, because I talked to different levels, even within the hospital itself, because I'm trying to figure out, because I'll go up to the front real quick, like, what is happening with this schedule? And that is just what they were being told to do, especially because they had opened up the portal for the clients to schedule. That's when it really went
yeah,
down into the toilet,
yeah.
like down the drain. When
In
they
the gut.
let them clients schedule their own appointments, not a request,
Yeah,
but an
that's crazy.
appointment.
That should have all been requests, but they went to the gutter with the gutter snipes and
And it
let it
wasn't a perfect system. Oh, and then we had a completely new software coming in
yeah.
that we had to
Was
learn.
unfinished.
And that should not have been rolled out as quickly as it was, because then
Mhm.
I heard they had to kind of scale that back,
Yeah,
the
they stopped.
rollouts.
Yeah, they had to stop it completely. I mean,
After
I knew for a fact that it was unfinished. I was told by,
it was unfinished.
yeah, it wasn't made.
It wasn't made for veterinary medicine in the
Yeah,
first
and it
place.
wasn't finished.
And it
It
wasn't
was
finished. I
it
didn't know
was
that.
higher up saying they'll have to learn it as they go.
And that's
Hmm.
exactly what we had to do.
Yep, this is what the text that helped. This is what I was told, and they were like, "We didn't want to do this right now, but they told us to do it."
That
But
is crazy. Mm-mm-mm. Yeah, that was, I think that might have been, I have completely forgot about that, but that might have been, yeah, I
they
think
might be in
that
there.
was the straw. Yeah, that was the last straw, I believe, was when we had to switch over to that. That was very frustrating getting through that, because it was so annoying. Ugh, that was an annoying system. I've never seen anything like that. I hope I don't go to a clinic that has anything like that, because that was stupid.
It was.
Not to say that the old one didn't need new, definitely needed to be modified, but it was a lot more user friendly. I could hop
It
on and
was.
figure things out.
There was a hospital that was down at some point every day, and clients would come in and they would say, "Well, we can't check you in. We can't
Mm-hmm.
and we can't do that every single day." How does that
Mm-hmm.
affect clientele at that point?
Mm-hmm. Mm-hmm.
So I hear, hospital making $10,000 now a week,
Mm-hmm.
a week.
Mm-hmm. A
That's
week. Oh
right
my
there.
gosh. Yeah.
Yeah, you're supposed to be making 45, 50.
Right. That's normally at least in a day, especially if you
Mm-hmm.
have a couple doctors there. Yeah. Wow. So yeah, I got up on out of there, but I have in this time it's no looking there's no looking back for me just from what being there the period of time that I was there, because before I was only there for the 2 weeks, so I didn't really know nothing. But yeah, so I mean, in any situation I would just try to have an exit strategy,
Mm-hmm.
as best as possible. And if you have to walk up on out of there, then that's just what it is. Because I know that feeling all too well of walking in and wanting to walk right back out.
Mm-hmm.
Um,
You got
but
to
if
get
you
on
can
back.
stick it through, if you can make it to your end date, whatever that date is, then I would try to make it. And this is kind of venturing off, but that is one of the other reasons why I do like relief, because if I go to a clinic that I do not enjoy, then I can not go back there again.
Yeah.
Because I told you about the urgent care clinic that
Yeah.
I went to, that I tried to venture off into urgent care because I'm like, well, I was doing this technically at my previous clinic. I was working as urgent care, but this was nothing but, and I'm like, then it was only me and one technician. The lobby was full, all the rooms were full.
I do not enjoy emergency medicine. I do not enjoy emergency medicine. Emergency medicine.
I think I had 2 to 3 sets of radiographs. One pet had to be sedated. The rest were like fight wounds, ear infection, skin infection type of stuff. But there was a few chronic like illnesses there that I'm like, should you be here? Like, you really should be at emergency.
Yeah.
Um, but that urgent care is like that buffer in between, and then they're open later. My shift was from 2 to 9. I didn't get out of there till almost 10:30. I said, you know what? This is not for me.
No. No.
This is
No.
not, and I never went back. And they were like, it's never like this. And that's what they always say. It's never like this. I said, well, I'm not coming back to find out
Who
if it is.
pays? Who pays people to lie about this? Who pays y'all to lie about this? Be real. Be real. I've always been real with people who would interview. Like, I'm gonna be 100% honest with you. Like, this, that, and the other. Like, you take it as you will, just like any other corporate situation. I feel like my advice is that, again, how I started, it's not for everybody. But you also, just like I told a doctor coming in, uh, shout out to Gibbs. I ain't gonna say everything, but shout out to Gibbs. Um, know your boundaries.
Mm-hmm.
They will
Mm-hmm.
ask them every single time. They will try you at every corner. Just when they feel like you get comfortable or
Yep.
you feel like you're at your weakest moment. I hate to say it like that, and that's neither like a negative or a positive comment. Like, that's just what it is. They will
Mm-hmm.
they will try it, and you just got to learn how to say no. If that's not what you want to do, that's not what I signed on for.
Yep.
Show me where I have to accept what this is now, within reason, of course.
Yeah.
But like, you
They
don't
gonna
have
push
to
them
do it.
boundaries.
Oh, boy, that so I'm just like, not me for this. It was so many times. I'm just like, and I know that's also a generational thing. Talk to
Mm-hmm.
older people that, like, oftentimes we had to do jobs in order to, to prove ourselves. And what have I been doing this entire time?
Right.
I'm not gonna do the job that you want me to do and not pay me for it. Like, come on.
Mm-hmm.
Like,
Mm-hmm.
there are some responsibilities that I would take on, but you know, again, know your boundaries within reason. Like,
Yeah.
No, let them know.
Yeah, I remember one of my friends. So before I started, I did talk to a couple of people that worked with the company for years. And so one of the girls, she was also down to part-time. And so one thing that I always remember she told me in preparation was to advocate for yourself. Like that was her biggest thing. And I noticed, I'm like, I just had to keep advocating. And it's like, to what point? Like, you just get tired. Like, I was tired of having to re-advocate for myself
Yeah.
because it was the same things over and over again. And when nothing is, changing, it's like,
Sure, the
why
only people I want to repeat things to is my kids. I
my
don't want to do
kids?
that. I don't want to
Right.
do that. The only people that I'm gonna do that for. All the rest of y'all grown.
Mm-hmm.
I don't have to keep saying the same thing over and over again.
Mm-hmm.
Respect my boundary. Respect what I
Mm-hmm.
said. Respect
Mm-hmm.
that I don't want to see six sick pets back to back to
Back
back.
to back. Back to
It's
back.
for that's within reason. Because otherwise, like, I'm not your girl. Like, I'm gonna have to get on down.
Mm-hmm. Mm-hmm. Yeah. Yeah. So, I don't know. Like I said, it was a learning experience for sure.
Yep.
So try to take something from each of my experiences. Um, but it's not somewhere that I would want to go back to because it's just certain things that even when I go into private practices that I do not experience there. And one of them, interesting enough, is aggressive pets, the amount of aggressive pets.
Isn't that interesting?
That is very
But the
interesting.
where I'm at, these pets, they'll be bad, but it's like,
Mm-hmm. That was one thing that I noticed that, yeah, everywhere has pets that are fearful, anxious, stressed, some of them, yes, aggressive, but the number, the
yeah,
amount, like I felt like we had so many aggressive pets and they feed off of the energy that
girl,
they're
I can
in.
say, are we the drama? Are we the problem? Because we was talking about this yesterday in a clinic and how their dog is anxious, but is most likely feeding off the owner's anxious nature, and
Oh,
people don't
yeah.
realize that. When you guys are anxious, your pet is going to be anxious. So you presenting them to us as anxious really gives a lot of information about you as well. So
Yes.
not saying they can't be anxious by themselves, but the way that you're like trying to drill it in,
Yeah.
calm down. Calm down.
Yes.
It's gonna be fine. We're gonna be fine.
It's
We know
gonna
how to
be
handle it. We're
fine.
professionals. We're professionals. We know how to handle this. Um,
Yes.
with that being said, it's like the anxious pet was not as bad as you made it out to be. So that like I feel like that's typically like the worst of it. Like we'll get
Mm-hmm. Mm-hmm.
but oh my God. It was like, why are y'all so angry?
Mm-hmm. Mm-hmm.
A lot of y'all. And
So many.
and honestly, to me, is the degree too,
Mm-hmm.
because
These are
I
babies that's
just
really coming for you. Like,
like they will rip your throats out if they could.
yes.
The ones I'm seeing, like they climb up the wall trying to get away.
Mm-hmm.
Like cat might skiddly pap you. Like, all right, move so I get up this kennel so I can climb up your wall. No, these cats coming into they were coming out the kennel at you. At you. You are the
Yes.
target.
That that's if you could even get them out the carrier.
Yeah, and at honestly, if you growl good enough, I'm not
I'm
unzipping
right
it.
there with you.
We're
Yeah.
close. We're good. Call the parents. Call the parents. I'm not doing this today. Mm-mm.
Definitely, yeah. I've gotten to that point too. I'm like, and what I'm saying is I do not experience the amount and the degree of aggressive pets at private than I have at the corporate clinics that I have worked at.
Mhm. I mean, hey, vets chime in if your experience is different. Let us know. But this is what it is. I feel you. I feel you on this. I feel
It
you.
is it's at least and I've been to multiple private practices where and some of which I have worked at for months at a time.
Mm-hmm.
And it is more, the appointments are scheduled, the timing,
Yeah.
is appropriate for what they're coming in for. Like some of them don't have less than 30-minute appointment slots. Like 30 minutes is the standard for healthy, and then they can go even longer. So it's spaced out to where it's not a lot of people in the lobby at one time. Like you may have one or two, like maybe one additional owner coming in, or somebody came in early or late or whatever, but it is not a bombarding
Mm-hmm.
of patients and owners in the lobby. I have
Mm-hmm.
not ever seen that at any of the private clinics I've been at.
Baby, and all the pheromones and the anxiousness from the owners to the pets, everybody is just like,
It creates the move from right there as soon
yeah,
as they enter the hospital.
okay, okay. He amen back here.
Uh,
But no, I hear you and I feel you. Um, I just I don't even know what else to say.
yeah.
I mean, that's just really the reality of things. It's not, I mean, it's not as inviting as you would want things to be, it sounds like.
Hmm. Yeah.
Yeah. And
Um,
one thing about it is I had to tell the nurse yesterday, and this might be something that other, incoming veterinarians and even some now that you just hadn't got to that point, but I am not a wrangler.
Girl,
Not a wrangler.
yeah. Girl.
I'm not gonna fight your dog. You should
Mm-mm.
want me to, but I'm not gonna fight your dog or your cat,
No.
especially not your cat, because your cat gonna win, and I'm not doing that. I'm not.
Exactly.
I'm sorry.
No.
Okay,
Not going to emergency and going through
because you're
surgery.
going to the emergency clinic. You're
You're
going.
going to emergency and you're gonna be on some antibiotics and you may have to have surgery. And that is the truth. That is the truth. Yeah, no, I'm not wrangling nobody. It's good to be in tune with, I'm very observant, very keen on the behaviors and mannerisms of pets. Some of them can still get you despite that. However, if you're questionable coming in, you're getting a muscle.
Period.
Um, and,
Period.
and it's for you to put on as the
Yeah,
owner. Because that's
I'm
the
not
true
trying.
test.
You're not snapping my hand.
That's the true test right there. If you, as the owner, cannot put the muzzle on, then
I'll show you something.
that shows you something right there. And even when, we have had to place the muzzle, because some of the owners even be like, oh, I can't do that.
So
He gonna bite me too.
wait a minute. So who's doing it? Who's? Oh, So you can't control your own pet. Oh no.
So that right there is the beginning of, me retreating. I'm already putting the game plan together. What drugs are we sending home for this baby?
Because you're
And
not
then
coming back.
sometimes I'll be watching them when they be, because I said, well, you know what? I'm gonna give you some time, and some space to put that muzzle on, and we'll step out and we'll come back in. And then I'll be peeping through that window and just watching the struggle.
Hmm. And I mean, it ain't nothing like a owner that's afraid of their pet.
No. Ain't
Jumping.
nothing like it. Yeah, or they wanna
She's.
be the ones to try to hold, but they
Oh no,
scared
we're not.
too.
We're
You ain't
not
doing
doing that.
that.
We're
Absolutely
not
not.
doing that. Baby, I had a dog bite his own the sweet meat. That little part behind
Mm.
your arm, that little flap. Ooh.
Mhm.
I said, ooh, yeah. Um, he's not better when you hold him.
No.
So we need Gavin. I don't know.
A little
Trazodone.
trash.
Little Traz, and then when you come back in, we gonna get a little poke.
We gonna get a little pokey poke. Yep.
You're going to sleep. You're being
Yeah.
immobilized, my friend. Mm-mm. Mm-mm.
Oh Lord. And when they get bit or scratched and you try to offer them a paper towel to clean it up and they be like, no, I'm all right.
It's okay. It happens all the time. Why do you have this pet in your home? He will eat your face while you're asleep. Like, imagine falling and becoming incapacitated. This animal is going to eat you.
This animal
That's
is
how he
gonna
feels
eat
about you.
you.
If he's going to bite you, I can't imagine what he would do if you were a weakling in your own home. Nope, 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 and nope. That's why I got to wait for what comes into my house. You said they start acting strange. The dog big enough, he's still getting a muzzle. If your head
Mm-hmm.
is bigger than mine, and my head is a little round. If your head is bigger than mine, we're getting a party hat. I'm so sorry. You could be the sweetest dog in the
Yeah.
world. Be sweet and with a party hat.
Yeah. And you know, some owners are so against it, like, oh, he's never had to have one of those before. Or they feel a kind of way about their pet having to
Mm-hmm.
have a muzzle placed on. And it's like, it's really not that serious. It's to protect everybody up in here. You
Because you can get
know,
it too.
you can get bit too.
You're not safe. You're not as much
So,
as you think you are. You're not safe.
mm-mm. And sometimes when you put the muzzle on, they be more calm with the
Mhm.
muzzle on, and they just
But
stand there.
sometimes they're like, protect me from myself.
Right.
Because I
I
got a lot
I
of
know I'm
feelings.
crazy. Yeah.
I
Help
got a
me.
lot of feelings. I get that. I've been there. I protect me from my look. I remove myself from situations all the time. Sometimes
Yes.
I may very well need a muzzle as well. Like, come on.
Right.
They know themselves better than you know them. A lot of the time.
Oh Lord. So I guess let me think of some takeaways.
It's a takeaway. Okay. I think that you should really evaluate where you want your career to go. You don't have to figure it out right off the bat. If corporate medicine is for you, if you like the money, if you do like fast pace, if you do, because there are some people out there I met a doctor like she
They
she
liked
paying
it.
she paying for her child school out of pocket, you know.
Hmm.
So that's she don't mind, and it's okay. It's not a judgment. This whole thing
Yeah.
was not a judgment. This is our experience. This is our perspective. These are our stories. So just figure out what direction you want to go in and go for it.
Hmm. Hmm. Yep.
Mine is not
Learn.
corporate medicine.
Yeah, say that again.
I said mine is not corporate medicine, and it took me since 2008 to realize it. And so that's okay. And again, things can still change, but like just making the decision based off of your self awareness and mental space and your goals and objectives are going to be
Hmm.
the easiest way to figure out if this is for you.
Yeah.
Yeah.
Yeah. And
What you got?
it doesn't have to be forever. Nothing has to be forever. If there's a goal that you're trying to accomplish, this can help you, especially if it's a financial goal, it can help you achieve that. Definitely advocate for yourself. Know what your boundaries are, because I think sometimes you might not even know what your boundaries are until you're being pushed too far in a certain
Mhm.
area and you realize, like, I don't like that.
I like it.
So you do kind of learn some of those things along the way, and then you're able to take those boundaries with you into, your new position. And then I guess that goes back with advocating for yourself, speaking up for yourself and not waiting until it's too late. Addressing things head on so that they don't linger. And those would be the biggest things. I mean, yeah, you do need to pay attention to your metrics, your numbers, knowing what those goals, the expectations that they have of you, what they even are, because for
You
the
did.
longest, yeah, you signed up for that part. And initially, I didn't even know what those numbers were. No
Yeah.
one informed me.
I still don't really know a lot of those numbers. Yeah.
So, having that conversation to know what do they expect from you. And it's a two-way street, so you can voice what you expect of them as well. And one question I always got anytime I presented an issue was whether I would have those meetings with my technician, my huddles.
Mhm.
Did I have that? Did I talk about that with them? What your expectations from your technicians and your receptionists are. And making sure that you do have those huddles so that they know every doctor is different. And so they know what your expectations of them are.
And that's
But
really big because a lot of in my experience, a lot of our vets and techs and all that, we can tend to be a lot more introverted and
mm-hmm.
neurodivergent and just very to ourselves and have a very low social battery. So we have to be able to fuel ourselves enough to get those conversations out because regardless of how you are as a person, it's still important to have those conversations. I mean, how else are you going to, address the conflict? Everybody is not going to do it for you.
Mm-hmm.
You have to face it head on, and it doesn't. And conflict doesn't necessarily have a negative connotation. You can just have a conversation. There's an issue, conflict, however you want to, address it. Just make sure that that is something that you focus in on. And it kind of leads me to my last takeaway is that everybody is not going to always respect your goals. So understand that if they don't do that, it's not on you to change that.
Mm-hmm.
So just try to kind of hone in on, again, what you expect of yourself and keep that focus. Don't let anybody change the trajectory of like where you're going.
Yes.
Um, of course, there's fine lines, right? Like people are trying to give you opportunities, but if it doesn't sit right with you, or if that's not what you saw for yourself, and it's giving you a bad feeling, not if that's not what you saw for yourself, and like, no, maybe I'm curious. That's
Mm-hmm.
but just keep your focus, period, because it can go a whole nother way. So
Yeah, keeping end goal focus. Yep. And I think the other thing I did want to mention was about notes, because that was one of my biggest struggles. And so I have a whole template that I take with me to all the clinics I go to help with that. So creating stamps and templates for like even the common conditions. So I do have something like that. And then some of the clinics that I go to now, they even incorporate AI into their note-taking process. So they have it hooked up to the computers in the room. So everything that you're
three.
saying, they'll basically you'll get an email of everything that was discussed in the exam room with the owner. And then you can, copy and paste that and modify it how you need to add it to the patient's
Wow,
file.
wow, that's crazy.
And you can do that yourself. I mean, I don't know. I mean, you could probably do that with ChatGPT, but I know that they do have specific ones for like, veterinary medicine related, but you're gonna have to pay for that subscription,
Yeah.
out of your own pockets. But that feature has been nice at some of the clinics I've been to is that AI feature. And I'm like, oh, I did say that.
Look, I mean, I hear you. Just them notes and
Hmm.
that AI stuff. I mean, that's having somebody record you is it's catch-22, but for
I
the note
know.
purposes, for the note
Hmm.
purposes, it's very convenient and good. I mean, of course, I told the story about my old boss, but in the same breath, like these corporate lawyers are very good at their
Hmm.
job, but you need to protect yourself in the meantime.
Yes,
So
yes.
that's the best way to CYA.
Hmm. Hmm. And now what I do, since I'm not even really overwhelmed with the patient load at the clinics that I go to, but immediately I go and I fill out, I just put the notes in right then and there. And
Yeah.
then it's just enough time to do everything. Like it's crazy. I have time to be in the rooms. Then we do all the things we need to do. I sit down because the technicians are pretty much, they're doing everything that they need to do.
Hmm.
So when you have a good, strong team and, an appropriate way to schedule these appointments, it all works out, even financially. Like
Yeah.
you can see half the amount of pets and either make the same or probably even more.
Yeah.
You
You spend
know,
enough time having those conversations, and everybody's happy.
everybody's happy. Even the
So they're
pets are
just
happy.
more willing to advocate, more willing to spend money, having the time and the education to spend that money.
Mm-hmm. Mm-hmm. So I have
Typical.
time to sit down, type in all my little notes, and then go on to the next. Then it's time for the next pet. Like it's crazy.
Yeah. I used to hate when clients say, I see how busy y'all are. That's not okay. That's not okay. Don't say it like your baby is not a number. It's not a number. It's not okay. Like
Exactly.
I would have this whole mental meltdown of like, stop saying that. It's not okay.
Mhm.
It's
It's
not
not
okay.
okay. Yeah. I mean, it's really a numbers. It's a big numbers thing in the corporate clinics, and that's the biggest difference is the quality gets, washed out.
Mm.
Like it gets
Oh,
diluted. And you're fighting for your life trying to maintain the quality of care.
fight for your life, honey. Fight. The
So,
fight continues. Like, ooh, honey. That's a real thing.
yeah. But okay, well, can I give the backstory on my shirt?
Yeah, girl, let's hear it. Let's hear it.
So while Black veterinarians do matter, I stand strongly on that. It says, especially since we are less than 2% of the veterinary population.
Hear it.
Um, my mother-in-law for my birthday bought me a shirt that said, and I'm gonna put the picture of it when I post this. It said, "Black veterans matter."
Oh, oh.
Oh my gosh. So as soon as I pulled that shirt out, I just died laughing. Because while, yes, Black veterans do indeed matter,
They are important as well.
I myself am not a veteran. And I thank every last one of them for their service.
Yeah, I would say thank you for your service. Thank you.
But, but I'm not a veteran. But she thought that was veterinarians. And I'm like, what Black veterinarian shirt is just like easily, found in a store? Like,
Yeah.
No, it doesn't exist. And she was with a friend who she showed her the shirt.
And it's still purchased. Still got
And
purchased.
she even thought, that that was correct and purchased the shirt. And so then my sister's friend, she found this one and sent her the link for it. And that's how I ended up with this shirt. That will be the conclusion of this episode, this series. We can
Whoop, whoop,
we
whoop.
we can always bring it back if we need to, but I think
Yeah.
we really touched on quite a few um areas of importance.
Yeah, because there were some things I think I pulled out, you know, Black women relationships in professional settings and
Mhm.
towards mental health too. So we
Yeah.
got some things to expound upon, but
Yeah. And when you are stressed, I must add, when you are stressed, whether it is physically or mentally, your body your body is going to let you know. So
oof.
you can keep going and keep pushing, but
Mm-hmm.
but your body will let you know at one point in time it's gonna break
Yeah.
down.
Yeah.
And that I experience because when I'm stressed, I can't eat. And so that's usually the thing that happens is that I will lose weight. That's one thing. But the other thing that I experienced this past year, I really felt like it was an attack. It was a month long from
Mm-hmm.
October to November. And it was me being sick. I was sick for a whole month
That's long.
of coughing. And this was during a time of real high stress in that clinic. And this was when I went ahead and put, because I'm like, well, my health, no. And that's when I put my resignation in.
Same. Same. Same.
Because I was trying to think, I was like, what was that last thing that like really was like, it's time to go. But it was that. It was once I was sick because it was just seemed like a regular cold. And
Mm-hmm.
then come like after a while, I was coughing for weeks. And it was a productive cough. And eventually I'm like, I had lost my voice. I've never like just
Hmm.
lost my voice like that.
I
And
feel
so
like
what?
I had that at one point.
Huh?
I feel like I had that at one point. I didn't lose my voice, but the
Mm-hmm.
whole coughing thing. Yeah,
Mm-hmm.
'cause I remember my aunt asking me, "How long have you been coughing?" Because
Mm.
um, I was like, "No, I'm not gonna die."
Right.
But but I mean, it was also for me, the whole my Graves' disease flaring.
Mm-hmm.
I had it under control on a whole holistic note. Oh no, we're not doing that. No, no,
Mm-hmm.
no. You're not forcing me into medication and surgery. So I feel
Yeah.
you. I feel you.
So eventually I went to urgent care because I'm like, this is going on for too long, and
Mhm.
tested negative for, like flu and COVID, no strep. And so we didn't know what it was, but I had to be put on antibiotics because there was decreased airflow
Ooh.
through my lungs. So I'm like, she didn't say pneumonia, but that was what it felt like. Because at one point I felt like I was getting better, and then all of a sudden I started feeling sick all over again.
Mm.
And so it does sound like I was like working my way towards a pneumonia.
Mhm.
And then I had to be on antibiotics, which is something I've never had to be on antibiotics for like an upper respiratory infection.
Mhm.
Um, and then soon after that, but it was a period of a month long. And I'm like, I remember being especially stressed around that time prior to me, getting sick. And I feel like even last year in general, I got sick so many times, at least 3 to 4 times, and I don't normally get sick
Mhm.
that often. So it definitely had to deal with the stress to where now it, just kind of opens up these pathways for whatever viruses or bacteria, whatever, to just take over.
Do his thing. Do his thing.
Yeah. But you
Sit
gotta
down.
know.
Put you down.
You gotta know when to go. You got to know when to go. And it should not afford, it shouldn't cost your health,
Mm-hmm.
your self-care, or any type of well-being, mentally, physically, spiritually, none of that. So,
Yep.
all
Gotta
righty.
hold them when to fold them.
You sound like an old poker player.
I know. It's a country song. Isn't it like George Strait?
Oh, girl, no.
This would kill me. I know.
Well, alrighty, that will conclude this episode in this series. Y'all stay tuned.
Woohoo! Next time. That's a wrap for this episode of Vetted and Vetman. We hope you enjoyed today's conversation as much as we did.
We're all about keeping it real, sharing our stories, and creating space for women, especially Black women, in veterinary medicine to feel seen, heard, and supported.
If you love what you heard, don't forget to download our episodes, subscribe to the podcast, and leave us a review. It helps others find us.
And stay connected with us on social media. We're sharing behind the scenes moments, resources, and a whole lot of real talk. Follow us on Instagram and Facebook at Vetted and Vet Med, and visit our website at vettedandvetmed.buzzsprout.com.
Plus, join our growing community on YouTube by subscribing to our channel. It's a space for deeper conversations, support, and all the good vibes.
Thanks for vibing with us. Until next time, take care of yourself and each other. You've been vetted and vet med.